So, if NSAIDs are beneficial for reducing pain, why do we need to learn about natural alternatives? Why would healthcare practitioners know and understand what other natural alternatives are available out there? There's kind of like probably two or three different answers to that. One, we know that NSAIDs are not intended for long term use. And second thing is, the longer a patient uses NSAID, the higher the risk for side effects. In the US, it's estimated that approximately 107,000 patients are hospitalized every year because of gastrointestinal side effects. And the most common reason for hospitalization due to NSAIDs is GI bleeding. It's reported that in some surveys that every time that a patient hospitalized because of GI bleeding that was induced by NSAIDs, it cost about $15,000 to $20,000 per hospitalization. So it's got a financial cost. It also has a health cost. We know that NSAIDs are one of the most common prescribed classes of medication for pain and inflammation. And when you look at the statistics, there are more than 111 million prescriptions that are written for NSAIDs in the US every year. And they account for approximately 60% of over-the-counter pain medication. So this is pain, as we know, is very prevalent, unfortunately, and they're looking for different solutions. We know that as we age, the prevalence for using NSAIDs is increasing. Some surveys are showing up to like 90% prevalence for use of NSAID. This was early 2000, published in American Family Physician Journal. And they found that among arthritis patients, NSAID was reported to be associated with the death of over 16,000 Americans every year. That's a lot of patients who are struggling. It's a lot of patients who are getting side effects. This is not just in the US, by the way. It's a worldwide problem. There was an interesting study published in England in 2016, and they reported that NSAIDs are responsible for 30% of hospital admission due to adverse drug reaction. Common side effects they reported are bleeding, heart attack, stroke, and kidney damage. This is a big topic, and I know that you've probably been in healthcare. You've probably seen so many patients that are coming in struggling with chronic pain. And Dr. Chill, I know that the second reason why NSAID could be problematic is because they don't really address the root cause of what's causing pain.
That's absolutely correct. This is a really great topic to bring up because so many patients ask about these alternatives, and we want to provide them with some options. And that includes what type of dosing, what are you looking for in terms of a length of time, and then while we're looking at the root cause. So there's always a time and a place to help to alleviate and provide short-term care. And then while we do the functional medicine stuff, right, which is looking at the long-term approaches, what are the root causes? And that's why we're kind of bringing up this discussion, because there are going to be times where we do want to help alleviate pain for our patients. And pain can be so severe and debilitating for them. We want to provide them with some of these options, and you will be asked some of these options as well. So we want to give you some of these alternatives to kind of go into how to properly dose these for your patients. This is an awesome herb that I often prescribe and recommend to my patients, and it's generally considered safe for many of your patients. And this herb is called curcumin, active component of the traditional Indian spice turmeric. So you may see it interchangeably. It may show up as turmeric on a supplement bottle, or it may show up as curcumin. Just understand that curcumin is the active compound that is in the spice turmeric. And it has been studied for anti-cancer properties, antioxidant properties, anti-mutagenic properties, and what is beneficial for pain is the anti-inflammatory effects. So let's take a look at a really great study that was done on curcumin. and pain, specifically for RA patients. So there was a randomized pilot study that was completed, and this was done to assess the efficacy of curcumin, and this is for active rheumatoid arthritis patients. It revealed that 500 milligrams per day, and this was for 8 weeks. What it showed was there was a statistically significant improvement in disease activity score, and this was done through the American College of Rheumatology. And this was, again, the suggested dose for the RA patients is 500 to 1,000 milligrams per day. And the active score was from the American College of Rheumatology score. And if you want to read a little bit more about this study, this was done in 2012, and it was produced in Phytotherapy, and it's called a randomized pilot study to assess the efficacy and safety of curcumin in patients with active rheumatoid arthritis. Now let's take a look at the mechanism so you understand how this works, and you can explain this to your patients if they're using this for pain. And this is being shown from the Journal of Pharmaceuticals, and this was published in 2021. You can see here that curcumin can impact in multiple different pathways. You see all of these different pathways there. Some NSAIDs and COX-2 inhibitors and curcumin significantly inhibit the expression of COX-2 and activity of NF-kappa. These are the two major inflammatory pathways. Again, that's COX-2 and NF-kappa. Another important pathway that we want to take a look at here in this image is the inflammatory cytokines, right? You're seeing inflammatory cytokines such as IL-6. Then there's also an anti-inflammatory cytokine, which is IL-10, which you can see in the middle there. So what we're seeing with curcumin is that it has been shown to reduce inflammatory cytokines such as IL-6, but it increases anti-inflammatory cytokines such as IL-10. So what curcumin is doing is it's selectively supporting a healthier immune reaction and a healthier inflammatory and anti-inflammatory reaction. We can also see that curcumin also supports the maturation of chondrocytes, right? These are the cells in your cartilage to help with bone structure as well. And these are specialized cells in the repair of the cartilage, as was just mentioned. And if you want to take a look at this slide a little bit more and dive into some of this research a little bit more, you can take a look at this journal called Pharmaceuticals. Article is called The Immunomodulatory and Anti-Inflammatory Effect of Curcumin on Immune Cell Population Cytokines. And this is in vivo models of rheumatoid arthritis. So here is another reason why we want to look at curcumin to helping with your pain patients. There's a really interesting study that was published in the Journal of Clinical Interventions in Aging. What the researchers did was they took 367 patients with knee osteoarthritis, and they had a pain score of 5 or higher. They randomized them into two different groups. Group number 1, they received ibuprofen of 1,200 milligrams per day. And then group number 2, they received curcumin extract of 1,500 milligrams per day. The study was done for about 4 weeks, and it was a double-blinded study. So patients and assessors did not know what each patient was taking. They found that 1,500 milligrams per day of curcumin extracts were as effective as the 1,200 milligrams of ibuprofen for the treatment of knee osteoarthritis with significantly less GI side effects. So if you have a patient that has osteoarthritis pain, you may want to consider providing an alternative for them besides the ibuprofen of 1,500 milligrams of curcumin. daily, and this can decrease their side effect risk, especially with the GI side effects.
Inflammation, this chronic inflammation, is responsible for so many of those chronic pain conditions. Interesting studies that show that curcumin can also reduce pain due to neuropathy, and other interesting studies that curcumin just has a really wide impact that is very, very important in helping patients reduce that inflammation and that pain. There's a lot, obviously, that goes into it, more beyond what we're talking about right now. There's one is the issue of absorption. Curcumin is not very bioavailable, so there's a way to increase bioavailability and absorption. You can add, for example, a small amount of piperine. Some supplements already include piperine, which increases the absorption, right? So some studies will already have 5 milligrams of piperine, or some supplements companies call it biopiperine. But there are supplements that already contain black pepper compound with curcumin to increase absorption. And then, of course, as Dr. Chill already mentioned, the second thing we want to make sure is that we also address the root cause, like what's driving that ongoing inflammation. If it's joint or nerve or muscle, like what's driving it, right? It could be changes in the functional medicine approach. We know that it could be dysbiotic changes in the gut, could be environmental exposure, it could be something they're eating, could be something that they're exposed to in home or in the office, it could be cellular dysfunction, right? There's so many different factors, and that's exactly what we do and what you learn in the advanced and clinical functional medicine program. These studies show that there is a significant reduction in inflammation, right? You just got to take it over time. In most studies, it's 3 months, sometimes longer. But we also want to always develop our clinical skills to offer also a longer term solution for those patients, right? And that's exactly what we do in the clinical and advanced functional medicine program. So if you're interested in more information, if you got any questions, let us know. We got specific modules, specialty modules on chronic pain and joint degenerative conditions and neurological conditions and geriatric and cardiovascular, women's and men's health conditions. Our program really includes, you're going to learn as you go through the program all these different specialties. So that will help you as a clinician to better understand what's the root cause behind the patient's complaints, and then quickly articulate several suggestions for your patients to help them with their symptoms and their conditions.